All right. Good afternoon, everyone. I'm Stephen Wantz, President of the Carroll County Board of Commissioners. First out of the gate, I would like to thank Governor Hogan for his leadership and providing a template for all of us to follow here in the state of Maryland. With this challenge, which is unlike anything that we have ever dealt with, we are making many of our decisions based on his and his staff's decisions and direction. So we truly do appreciate that. As of today, Carroll County is under a local state of emergency, so we can continue our parallel approach with state government. We will remain in effect with our local state of emergency until the duration of the state's state of the emergency. So we are working in conjunction with them. I, as the President of the Board of Commissioners, will be taking the lead in all decisions while under this state of emergency, but we'll be working closely with my colleagues, two of which are here today. I have Commissioner Ed Rothstein and Commissioner Dick Weaver, and together we are tackling this issue. So this was going to be a proactive press conference today to share with everyone what we're doing to get out ahead of this. And when I introduce our health officer here in a moment, Ed Singer, you will understand why I said that and why that has now changed. But let me just emphasize a few things that we have made a decision on as a result of our local state of emergency. We are operating under the 250-person rule that Governor Hogan has for large gatherings. However, we are strongly advising everyone in Carroll against any public gatherings, and we are asking that they be postponed immediately until further notice. We understand the hardships that this will create for our nonprofit communities, but we know this is in the best interest of public safety. Access to this building will be by appointment only. Any county meetings that are not critical or time sensitive have all been canceled. When entering the building on an appointment, individuals will be asked the magic 3 questions. And they are you feeling well? Have you traveled out of the country? And have you been in contact with anyone with COVID-19? And we're asking all, as everyone else is, to use common sense. Hand washing, if you can't do that, hand sanitizer, and you know how the rest of that rolls. We are advising staff that all outside business, training, and travel, all of that is suspended until further notice. Our open sessions, which occur on a weekly basis, will continue temporarily and will be live streamed for public viewing. There will be no access to open sessions unless it's by appointment only. Now, we know we have some scheduling conflicts that are coming up. We have the Planning Commission that is scheduled for this coming week. They will be held as scheduled on Tuesday, but there will be no public access. That will be by appointment only. The other things that are coming up we will deal with in the coming weeks. One important factor, because we have a lot of this, those who wish to pay their taxes, and we have a lot of in and out traffic on that, we are encouraging all of you to use our drop boxes, and we will make sure that you get a stamped receipt for that. To our employees, business as usual, temporarily. Again, because this is such a fluid situation, we could very well indeed be changing that at any moment. But right now, business as usual. We're telling all employees, if you aren't feeling well, please don't come to work. And managers in our building, all of our department heads have the authority to make a decision on whether or not employees should be here. Now, I'm going to introduce some of the folks that are behind me and give them a chance to say a few words. Certainly because of what I alluded to earlier, we have a situation here now in Carroll, and I'm going to introduce our health officer, Mr. Ed Singer.
Thanks, Commissioner Wantz. I'm Ed Singer. I'm the county health officer here in Carroll County. And I guess one key thing is Commissioner referred to this was going to be a proactive meeting. Well, even though we're here today and we're going to talk about our first positive case in Carroll County, it really doesn't change anything, because this morning we met with some of our leaders of our nonprofits, law enforcement, EMS, other community organizations that we work with on this public health emergency to talk about how it's impacting them and what our plans were. And we were talking to them about how we wanted to be proactive. But we knew we were going to get a case at some point in time, and we know we're going to have more cases. So the fact that Carroll County has its first case today really doesn't make a difference with what we wanted to tell you this afternoon. But I know everybody's interested in knowing about the cases that are happening, and since this is the first positive in Carroll County, we'll mention that we had a person test positive in Carroll County. It's a male who's in their 40s. They had very mild symptoms and are recovering at home. So we're working with the state to do traceback to make sure that we can identify any potential contacts that the individual would have had. And we'll let the public know if there were people who were potentially exposed. As I mentioned, it was mild symptoms, recovering at home. That's really about all I can say about that. So people don't need to really get excited about this. Generally, most people are going to have mild symptoms from this disease, but we do want to be careful not to put stresses on the healthcare system. The health department will, because we are concerned that there'll be a lot of calls and questions because this case was just announced, that our call center will be open this weekend from 8 to 5, just like it's been during the week. We had normally said we were going to do this Monday to Friday, 8 to 5, to try to answer concerns and questions people had from the community about COVID-19, but we are going to open the call center this weekend. Generally speaking, though, if you are concerned about your health or think that you may have contracted a case, you need to call your primary care physician and talk to them about it and ask them if they do testing. And we're trying to increase the capacity of our private sector and the private labs to be able to do this, because public health certainly can't do this alone. Of course, as Commissioner Wantz referred to, the governor has done some unprecedented things with the restrictions on the events that are 250 people or more, and we, in conjunction with the county, are recommending the postponement of those large events that Commissioner Wantz referred to. It's not because we're worried about widespread severe illness, and I want to make that clear. What we're trying to do is prevent the spread, and we want to spread it out. We want to slow the spread so that our healthcare system can keep up and not be overwhelmed. We also want to protect our most vulnerable citizens, our elderly people and people who are immunocompromised. This disease doesn't seem to be having an effect like the flu does and things like that on our younger population. Generally, our most vulnerable population with this is the elderly and the immunocompromised. And then the other thing is we still need to maintain critical services. I think the commissioner kind of covered that as well. So taking these steps early is the thing we're going to do to make this the most helpful. I mean, we have one case now. I thought we were going to be up here saying we don't have any cases and having people concerned that we were overreacting. But it's all about a curve, and that curve peaks quickly. And what we're doing is we're learning from what happened in other countries. Specifically, Italy really struggled. They had 300 cases in a short period of time, and their medical system was able to deal with that for a while, and then it became 1,000, and they were stressed, and then it became 10,000, and they may be faced with having to ration resources because their healthcare system's becoming overwhelmed. And these steps that we're taking here and the steps that the governor's taken are necessary in order to prevent us from having that kind of a peak and to cause unnecessary stress on our healthcare system. We really want to be able to make sure that our system is not overwhelmed. So, as the commissioner already said, if you're planning a gathering, do what you can to cancel it. You know, if you can do something by teleconference or by video conference, that's also something that's advisable. The extraordinary measures put forth by the governor will help protect our citizens, especially the most vulnerable, older adults with chronic health conditions. Some of the restrictions may be inconvenient, but we can all do our part for our community and for our country and our county. So thank you very much, and I'll turn it over to Commissioner Wantz.
Thank you, Ed. One of the critical partners that we working with is Carroll Hospital Center and the LifeBridge system. I'd like to introduce their Chief Medical Officer and Vice President of Medical Affairs at Carroll Hospital, Dr. Mark Olsik.
Thank you, Commissioner. Our top focus at Carroll Hospital, the LifeBridge Health Center, is keeping our patients and team members safe. Our teams have been actively preparing for the potential arrival of COVID-19 since January. Our COVID-19 Command Center team meets daily, at least daily, and continues to work with our clinical and medical staff and facilities across the LifeBridge Health System to take all necessary precautions in coordination with the recommendations from the Centers for Disease Control and Prevention, as well as the Maryland Department of Health. We are also coordinating with all other appropriate local, federal, and state agencies. To better care for our patients and to prepare for a potential increase in patients who need screening, we have set up a tent outside the emergency department as an additional triage area. We have also implemented drive-through testing for pre-screened, I must emphasize, for pre-screened patients who have been referred for testing by their primary care provider. LifeBridge Health's leadership team has been continuously monitoring the situation, and as a result, we have adopted a range of policies to help lessen potential risks. We have changed our visitor policy, we have asked our volunteers to stay home, and we have canceled community programs and events through April 30th. This is a rapidly evolving event. We are doing all we can to limit the spread of the virus and protect members of our community so that we can provide the best possible care for those who need it. Thank you.
Thank you, sir. The next individual that I'm calling up is our Superintendent of Carroll County Public Schools. They have a big role in this as well, Dr. Stephen Lockard.
Thank you, Commissioner Wance. As was announced yesterday at the Governor's press conference, under the direction of State Superintendent of Schools, Dr. Karen Salmon, all Maryland public schools, including Carroll County Public Schools, will be closed. That begins Monday, March 16th, extending through Friday, March 27th. It's anticipated at this point schools would reopen on Monday, March 30th. In addition to that, all Carroll County Public Schools and all non-Carroll County Public School sponsored activities in our school facilities have been canceled. We have been sharing information for many weeks regarding COVID-19 with our parents and our staff. We're so appreciative. All of that has gone through our health department. Much of it was co-authored with our health department partners. We're so appreciative of that partnership, of the partnership with our Board of County Commissioners and our county government agencies. We have done a lot of things to try to educate, inform, and better prepare our students and staff. Their health and safety is always our #1 concern, whether we're looking at a pandemic issue or not. And so we're really proud of our students and our teachers and our school communities for taking the information seriously. We've put many just best practice strategies out there, hand washing, good hygiene, all those things that are important really any time of the year. While schools are closed over the next several weeks, we will continue to ensure and go back through all of our schools and school buses to ensure that those are continually being cleaned and disinfected. Also, as we speak, we're dismissing for the day here. Students are being provided with materials to allow for learning to occur during the closure. There'll be a variety of activities available, including online as well as traditional paper pencil. We have links to all of these things on our website. Every communication we've put out to our schools, to our parents, and to our communities are included on our website. And I'd like to thank our teachers and staff for working so quickly and efficiently over the last several weeks to begin to put those things together in consideration of a closure such as the one we're facing. I'd also like to mention in closing that Carroll County Public Schools has rapidly put together a free meal distribution that will be available, very similar to the one we do in the summertime, for any child under the age of 18 at selected sites in Tawnytown, Westminster, Manchester, and the South Carroll area. Again, the specifics of that are listed on our website as well. So in closing, again, I want to thank the opportunity to be here today and for the ongoing partnership, and we look forward to returning to normalcy as soon as possible, but know that these preventative measures will get us there even quicker. So thank you.
Thank you, Dr. Lockhart. Just a few more folks here that are very important to us. Our president of the Carroll Community College, Dr. James Ball.
Good afternoon. To stay in concert with the state's effort and the county's efforts to take stronger measures to limit exposure to the virus, we have done several things in terms of working with our credit students, our non-credit students, and our faculty and staff. We announced this morning that we are closed for spring break for students Monday, March 16th through Sunday, March 29th. We'll resume classes on March 30th and will continue through March 12th in an online and remote learning format. After that time, we will be making services available to students on campus, but through the period of March 30th through April 12th, we will be providing some support services on campus. We're concerned about the students who may not have access to online resources, so we're going to let them avail use of the campus on a case-by-case basis and give them access to computers and so on. We'll be keeping the campus clean during that time. We'll be reevaluating after April 12th whether we need to extend that online and remote learning period. So for non-credit students and for our employees, we have also listed alternative arrangements. Our employees will be on campus next week in preparation for completing all of our online and remote learning opportunities, but we will be closing as of Wednesday, March 18th at 4:30 and starting spring break for staff. And we will resume again after on March 30th with staff. We will provide essential staff on campus. We'll make sure that we are practicing appropriate social distance practices among staff and students as they come onto campus. We're also asking that all students and staff who have traveled to CDC areas that are designated as very high impact, that they self-identify and volunteer to self-limit their activities to their home and so on. So we are taking the steps to make sure that students who may have been exposed aren't coming to campus if possible. And that, among many other things, are what we have planned at the moment, but this is a very fluid situation, and it's changed 3 times in the last 3 days, and no doubt will continue to change and evolve. Thank you.
Thank you, Dr. Ball. Okay, just a couple more folks, and all of these are very much influential partners with us as we go through this adventure together. Our Carroll County Sheriff, Mr. Jim DeWeese.
Good afternoon. I tried to close the police department, but apparently that's frowned upon. So, but with Dr. Lockhart closing schools, that gives me additional manpower, so I'm grateful for that. I oversee law enforcement and corrections in the county. As you can imagine, our jail has, on a regular basis, about 200 people on a daily average with staff and with inmates. So the jails in this county and throughout the state, local and state, have always had a pandemic outbreak policy. So those things are being put in place as we speak, as things evolve. On the law enforcement side, with additional manpower, you'll see more law enforcement presence at our local hospital or institutions where medical care is being provided. And you'll also see it at our retail stores. Now, I know it is human nature to run out and buy as much toilet paper, bread, and milk as you possibly can when these things disrupt society, but I'm telling you that they are still manufacturing toilet paper, milking cows, and making bread. So slow down a little bit, and everybody should calm down, and there's more than enough out there. So, but in the case that there's any sort of chaos at a retail facility, you'll see a stronger presence from law enforcement at those institutions. But we are fully prepared. We always have been. First responders are the ones that are always out there when things like this happen. We've always got plans put in place. And so our job will be to support the folks that are behind us, and we'll continue to do that. Thank you.
And on that theme, I'd like to call up our emergency manager, Valerie Hawkins.
Good afternoon. I am Valerie Hawkins. I'm the emergency manager for Carroll County. Our agency here in Carroll County has been working in close cooperation with both the Maryland Emergency Management Agency and the Carroll County Health Department over the past couple of weeks. We've been mainly focused on coordination of messaging, making sure that we can get good information out to all of the members of the public that rely upon it. And we have been reviewing and updating response plans. That has been a very challenging process. We are now moving into a time where we need to raise our activation level for our Emergency Operations Center. We have been activated at the enhanced level since March 5th. We will be raising that EOC activation level to a partial activation level with selected agencies. We're going to be doing that as of 1800 hours today, 6 p.m. today. We will also be doing that in a virtual format. So traditionally an EOC is done in person. We have all of our agency representatives that meet in person. We will be doing that in a virtual format to take advantage of the teleconferencing capabilities that we do have to try to keep some social distancing going on with our responders too. We want to make sure that everybody stays safe and well. And moving forward, we'll just be working on coordinating response actions with all of the different agencies that you've heard today and multiple other agencies. Along with the Maryland Emergency Management Agency, we'll be working on resource requests and moving forward into the future, keeping everybody safe.
And quickly, I'd like to hear from just 3 more folks. I'd like to call up our Director of Public Safety, Mr. Scott Campbell.
Thank you, Commissioner. I believe probably the most important thing that I can say is that there was to be reassuring that a number of additional measures have been taken to ensure the robust and continued capability of the county's emergency 911 facility. Some of those measures have already been taken, and as you heard, this dynamic situation, additional steps will be taken accordingly. And the single most important thing is, I think the best expression is business as usual. If someone needs assistance in the event of an emergency, I am confident, and there's no question in anyone's mind that the assistance will be there if you need it, and this will not impact those services. Thank you.
On the public safety theme, I'd also like to bring up for brief comments, because it is affecting that aspect of what we do in our daily lives as well. That's our court system. I'm honored to have our state's attorney with us today, Mr. Brian DeLeonardo.
Well, good afternoon. I serve as the state's attorney for Carroll County, as well as serve as the president of the Maryland State's Attorney Association, which includes over 600 prosecutors statewide. We began in our office measures earlier this week to help mitigate. As we've seen, it's not a matter of if, it's a matter of when. We have had all of our prosecutors working from home and only coming directly into court when need be. We have separated our staff into teams with the hope that we would not run into a situation where one person who became affected by this would shut down our entire office and we wouldn't be unable to serve the citizens of the county in court. I appreciate the responses that we've seen. Obviously, these are very dramatic responses. I think they are absolutely important to do. When we look at a national level and we see the NCAA basketball tournament being canceled and the NBA, it is clear that these are not being made lighthearted. The one thing from the court side I will say is I really urge the administrators statewide for the court to reconsider their decision and to also close court in order to only deal with essential matters during this time. While we can take all these measures and the schools can close and the colleges can close and we can cancel events over 250, the reality is that everyone is still coming through court. So far, the judiciary has only eliminated jury trials, which is a very small percentage of the cases that are handled. That may save 12 jurors from coming in, but we will have hundreds of people coming in for traffic court and district court on a daily basis. I really urge them to reconsider because these measures are only going to be successful if everybody works the same direction. All of these people will now be bringing their children into the court that are not going to school. And it just seems like if we're going to follow the governor's very clear and decisive action, as well as our county leaders, we need to all be on the same team. So I certainly am hopeful that judiciary considers that and takes that step forward. So thank you.
Thank you, Brian. And finally, it has been identified that the most vulnerable population that we have seen so far, and that also subject to change, is our aging population. And we certainly have a large aging population in Carroll County. So I've asked our Director of Citizen Services, Celine Steckel, to say a few words because it is also affecting our senior centers and those associated activities. Celine?
Good afternoon. The Department of Citizen Services, which includes, as Commissioner Wance identified, the Bureau of Aging and Disabilities, also includes our Housing and Community Connections Bureau, which in that bureau we have our housing voucher program, which 93% of our individuals that are in that program are older adults or people with disabilities. And also our local management board is in our department, and we will remain open at this time providing services. However, our services will be operating on an appointment-only basis. We will continue to provide appointments for essential services only during the state of emergency. We are encouraging our clients to contact us by telephone and by email rather than in person at this time, and only asking for assistance if it is truly necessary. If your service can wait, please do so until the threat of the virus is gone. All county senior and community centers closed yesterday as we put out that press release. This was as a result of a directive from the state of Maryland, and we will remain closed at our centers until a new directive from the state has been received to reopen. We will be reaching out during this time to our senior center members to ensure that we'll be reaching out to them by telephone to ensure that they have access to food, an adequate amount of medication, and any other emergent needs that they may have. If we identify that someone does have a need, we will ensure that they have access to what they may need. Our older adults and people with disabilities continue to remain a priority to us. We also want to announce that our Seniors on the Go Aging and Disabilities Expo will be postponed. We will be announcing the new date as soon as we have identified that date. It was scheduled originally for April 15th, and all vendors that have registered will receive information regarding the process going forward. HSP, who is Carroll County's homeless service provider, is a safety net for our homeless population. They will continue to operate. They have adopted many preventative measures to keep their facilities clean and have gone and attended meetings and virtual meetings to ensure that they have the most up-to-date information to serve the homeless population in their shelter system in a safe manner. They will continue to operate emergency housing service assistance and will encourage their folks to do so by telephone, but will take in-person appointments as necessary. We also have confirmed that our local soup kitchens that provide a great support to our community will continue to operate. They will be modifying the way in which they operate. Typically, they are planning to, they have done an alternative that they're planning, most of them, to offer bagged lunches for pickup rather than the congregate meal setting. So please contact them directly for more information about how they plan to do that. But those services will continue. Thank you.
Okay, thank you. So with that, I just need to say a couple things. It is quite apparent that Carroll County is all in on the mission of making sure that we do all that we can to assist our citizens in these trying times. I also need to announce that as of tomorrow, all Carroll County public libraries will be closed through March the 29th. So let's be clear, life as we know it has changed, and we are all aware of that, and I'm extremely proud to be the leader of this county, along with my two vice presidents, to see the expertise that we have behind us here. We're on this, we've got this, and we'll continue to provide the best service that we can so that we can get through this. With that, I'd like to also again thank Governor Hogan for all that he has done, the outreach that he is providing, and all of the leadership that he has given to us so that we can do these things very well under his direction. With that, I'll take any questions for any of these folks that we have, if there are any. Right here.
Can you tell us anything about where the person with COVID-19 has been in the county?
Mr. Singer.
So there's only certain information with these cases that we're allowed to release in order to protect the person's identity. And essentially, it's been decided that all we can release is the fact that the person's a resident of Carroll County.
Can I just follow up and ask you, I totally understand the privacy restrictions here. Do you know, have you identified how it was contracted, and I'm assuming you followed up with the ring around this patient, or is this a community?
So I mentioned that the person, it was not associated with foreign travel. We have an idea of how we think the person got it, but it would be speculation at this point. I had also mentioned that one of the things that we're doing, we're working very closely with Maryland Department of Health to determine if there are people that, from a tracing standpoint, to determine if there are people that we need to reach out to in reference to where this person may have been and who they may have come in contact with. So we're working on that as we speak, and we will notify the public if that's appropriate, or notify individuals if we know who those folks are. I can't say. Like I said, it's speculation. So I mean, we could stand here and guess, but I can't give you an answer. Well, like I said, I can speculate, but I can't tell you where they got it because we don't know.
I guess I'm just asking because if it's contracted within the community, like the person in town.
Well, we've had no cases in Carroll County, so it's very unlikely that they contracted it here. But I can't say for sure where they've contracted it from.
Thank you.
Yes, ma'am.
Can you say how many people are being tested in Carroll County?
No, that's not information that we're able to share. We've been sharing information about positive cases, and that's, that direction's coming down from MDH as far as what information we're allowed to share with the public.
May I ask a question of this state's attorney? I guess I'm asking this as in both of your roles here. What happens to a trial where jury conceded? Will that continue through, or will that be postponed? And is there any, and I know this may have to do with the sheriff as well, but the federal prison system, just announced they're not allowing any visitors, including attorneys, for the next 30 days. What's the situation here in Carroll, and what's the reaction as an attorney to that?
Well, I think that's the point that I was making, is that as far as my understanding of the order, that obviously any current jury trials that were active were certainly going to be done to completion, but that there was going to be no new jury trials allowed until the beginning of April. Again, as we've heard a number of times, and even when we have a case, we can give very little information or know exactly who has it and who doesn't, because there's only the people that we know that have been tested. Our concern is that as prosecutors, and I believe I can speak for the sheriff as well as law enforcement, the reality is when we go to court, We are bringing inmates over. We are putting new inmates in. We are asking witnesses and individuals to come to court. We have a lot of different people, some with substance abuse issues. We have a lot of different people coming into court, and the reality is if we're taking all of these measures for social distancing and to limit the spread, it seems to me having several hundred people pouring in daily through one courtroom is probably not the best solution if we're trying to limit. So I think the concerns, even in terms that you raise, I left the meeting a little bit earlier, it's a concern certainly for those that represents clients. The ability to access those clients, to go into those facilities. And of course, if that attorney happened to be, have it not know it, you might now inject it into a jail population that otherwise would be protected. It is why I've urged, I really believe there should be an evaluation of this on the state level, as we've seen in the federal side, that I think you're going to see increasingly these restrictions because we can't get a hold of it if we don't, everyone doesn't do their part, and that's where we are.
And Sheriff, can you
I can.
say if the visits have been
We have restricted visitation with anyone from the outside. Now, we typically with attorneys, they're allowed to come in and have physical contact with their clients, and we have space within the facility to do that. What we've done is we've limited that space. So now an inmate will have contact with an attorney, but it will be from a visitation area where it's not face-to-face, and we can control that area. If it gets to the point where there's a larger outbreak, then we would likely restrict that. But we're not business as usual in the jail. As you can imagine, it's a 40,000 square foot facility with 200 people in it, but they're very good at making sure that the jail stays clean, restrict the amount of people that come in. There is a policy and procedure when an inmate shows up outside of the facility before we will accept them. We do have a good medical provider that's within the facility, so we have all the checks and balances there, and the state's attorney and I talk regularly, daily, especially about this. So we want to make sure that if there is something going on and an attorney needs to see their client, that we can make that happen without any fear of transmitting the disease. So, okay. Thank you.
Okay, I'll take one more.
When did the person come forward that thought they might have COVID-19? And I know it was announced today, but when did you actually get the results?
We received the results of the test today. It's, I mean, the state's reporting those out and notifying local health departments as soon as the results are available.
May I just ask a question of the hospital, just because I think you want me to clarify? And you mentioned the drive-through testing, and I just want to make sure if the drive-through is only pre-screening and only if you have been approved by another doctor, how do you, so you don't have people showing up, what do you bring with you to prove?
Correct, correct.
So Carol's part of the LifeBridge Health system. Our primary care providers and aligned providers that are in our system have been given a phone number to contact the LifeBridge COVID Telehealth Command Center. The provider, the primary care provider, will then go ahead and contact the Telehealth Command Center, where there's a number of nurses standing by, and the number of calls keep increasing as you can imagine. And they will then go through the CDC guidelines for people who need to be tested. In order to keep the patients who are otherwise well, displaying no symptoms, not requiring hospitalization, away from our hospitals and away from the emergency rooms, so that we can preserve the continuity of care for those who most need it, those patients are directed to a drive-through center at Carroll Hospital. It's actually out in our parking deck. We know who's arriving beforehand because the telehealth center tells us. We actually make contact in most cases with the patient who's arriving by their cell phone. We have them stay in their car with the windows up, radio off. We actually have a dedicated cell phone. We tell them, call this number. We talk to them. We're maybe 10 feet apart, but maintaining good social distance with their window up. We verify their information by having them hold up their driver's license to their driver's side window. We ask for the appropriate 2 pieces of identifying information. And then at the very last minute, we have them roll down their window. We take a very quick swab of their nose, and put it in a sample vial, and we'll send it off for testing. So the entire actual sampling process takes about 5 seconds. We give them an instruction sheet, and we'll let them know the results of their test as soon as possible.
And so that is it will be a COVID-19 test that you're swabbing for?
So we actually run 2 tests. First, so as not to overwhelm the testing facilities, we run a test for the 17 or 19 most common viruses somebody could contract that seem like the flu or could mimic the symptoms of COVID-19. If those are all negative, and we recognize there's a very low co-infectivity rate, so if you have one, you're unlikely to have the other. So if you're positive for one of those, we stop. If those are all negative, then the sample is sent off for COVID testing. Okay.
Okay, I want to thank all of you very much. I also want to recognize the fact that we do have a great partnership. Carroll Hospital Center, unlike other jurisdictions, the only game in town, and we're very lucky to have the partnership that we do. Along with Dr. Olsik, I want to point out that LifeBridge Health's Emergency Management Corporate Director joined us as well, Mr. Tom Jeffers. So if anyone has any questions for Tom after this is over, certainly feel free to ask him. So other than that, again, thank you all for being here. We're going to continue this effort. As you can see by these experts behind me, we, again, are all in on this, and I want to thank all of you for attending. Thank you.